Hi, we're going to talk about health, illness, and wellness, appropriate for this pandemic we are experiencing. Hope everybody's doing well. I'm sure you've heard about the World Health Organization. It's been in the news a lot lately. Here's their definition of health. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, meaning it's not just physical health. Definitions of health. It's to be free from pain or other limiting certain symptoms. You want to be as active as you want to be. You want the ability to do what you want or you must do. You must be in good spirits most of the time. And you develop the whole mind, body, and spirit connection. There are 7 components to the wellness model. You're in the center of the whole wheel, and it's a state of being, it's a state of well-being. It's your own personal responsibility. It's also a process. You have to go to get ultimate wellness. And it depends on your daily choices and decisions regarding nutrition, stress management, physical fitness, emotional health, preventative health. And it's an ultimate goal, and it's holistic and individual to each person. So the first thing on the wheel is emotional health. Lots of things go into emotional health. You've got to understand and recognize your own feelings, accept your personal limitations. Sometimes that's hard to do. Express your feelings appropriately. It's hard to do for some people too. And manage your stress, which we're all learning to do in an unexpected way. And some people handle it better than other people. Then physical wellness kind of speaks for itself. Hydrate, nutrition, try to keep your exercise so you have body fat proportion. Avoid excessive use of alcohol or drugs, including prescribed medication, and just to avoid risky behaviors in general. Again, this can go along with the coronavirus, keeping a safe distance away, 6 feet away. Otherwise, you're having risky behavior. Social health. You maintain the intimacy with those that are close to you. Being cooped up in the house, sometimes it may be a little too much. Being able to interact successfully with others within your own environments. And most importantly, develop respect and tolerance of each other's differences. There's environmental wellness. You support healthy air quality, water resources, trying to improve your community standards of living, buy locally grown foods and services, keep the environment healthy so we can continue to live on this planet. There's occupational wellness. This is hard sometimes to balance a personal life with your work life. And understand your beliefs in education, employment, and personal life, and seek to understand other people's beliefs. And a person's beliefs can affect their relationships with others. Spiritual wellness. Human beings believe in a uniting force. Sometimes it's religion, nature, science, or some just call it a higher power. Having belief brings meaning and purpose to life. And usually the beliefs form one's morals, values, and ethics. Last but not least is intellectual wellness. It has the ability to learn, develop thoughts, and reasoning for use in developing a career, personal, and family life. Exactly what you're going through at nursing school right now. Ability to cope with challenges and problem solve. Again, that's what you're going through this at home. And importantly, to learn, retain, and use new knowledge. And that's what our nursing program is all about. And hopefully you're all becoming intellectual as well. Health and well-being. Well-being pretty much equals wellness. It's very subjective, it's perceptional, and it's very personal. Whereas health incorporates this personal perception. So it takes your perception, incorporates it, and then it's expressed on a continuum. This is Travis's illness wellness continuum. Wellness is across the entire continuum, not just where there is no illness. The role of the registered nurse is to meet patients where they are on that continuum, and through awareness and education, lead them to growth and their highest level of wellness and optimal health. So the 3 key steps to wellness is physical awareness, stress management, and self-responsibility. Wellness includes the entire continuum, while treatment model is only ill focus. There is a video on the wellness continuum that you can look at. It's on Blackboard. There are some variables to health beliefs and practices. First, there's internal dimensions, biological. It's your genetic makeup, gender, age, developmental level. There's your psychological, which is your mind-body interactions and self-concept. Then there's your cognitive level, which is lifestyle, risk factors, spiritual, and religious beliefs. You also have external dimensions, your psychosocial and socioeconomic, and your family and cultural beliefs and practices. Environmentally, you have your geographic locations, natural or manufactured hazards, pollution, natural disasters, standard of living, education, occupation, and income influences. Family and cultural beliefs can be transferred from one gender to the next, both healthy and unhealthy things such as abuse, family remedies to treat illness, etc. Then you have your social support networks, which offer support, encouragement, assistance, guidance, things like AA. Levels of prevention. This is something important for nurses to know. The first level is primary, and you can remember that by promotion or protection, both begin with P. These are things like health education, immunization, risk assessments, sanitation. It's promotion of health before the problems occur. Remember, primary is promotion of health before the problems occur. Then you have secondary prevention, which is screening, early identification, and or treatment to prevent complications. So you maintain personal health, function, something like a mammogram is considered secondary prevention, colonoscopy, your screening looking for early identification of diseases. And last but not least is tertiary prevention. Think of tertiary as training and teaching. It's the restoration or rehabilitation of optimal health or function. It's prevention of deterioration of a condition or disease. So you're training people ahead of time how to use things, how to teach things. Like when you show somebody how to take their own blood glucose level, that's considered tertiary prevention. There's the nurses' role in health promotion. We're role models, we're facilitators. Of course, we're teachers or educators. We advocate for the patients. We coordinate services. We're also a consultant. There's a link on Blackboard to the nurses' role in health promotion. It's about a 10-minute video, but it's an excellent video, and I suggest you check it out. Healthy People 2020. This is a government initiated thing. Healthy People 2020, there's the link up there, www.healthypeople.gov. It's also on Blackboard if you care to look at it. Its vision is basically they want a society of people live long, healthy lives. Mission is, identify national health improvement, increase public awareness of health, disease, disability, and opportunities to progress, to provide measurable objective goals at local, state, and national levels, engage multiple sectors to take action to strengthen policies, practices based on best evidence and knowledge, identify critical research, evaluation, data collection needs. This mission, all these points in this mission is very important right now. We're doing all these things to fight the coronavirus. We're teaching people about it. We have measurable goals. Sometimes they fight at the local, state, and national levels, but at least we're trying. And we're trying to identify critical research, things like cures, vaccinations, mitigating interventions, and obviously we're collecting a lot of data to get to this point. Healthy People 2020's overreaching goals is basically we want longer lives, free of preventable disease, injury, premature death. We want to eliminate disparities and improve everybody's health with all groups. And we also want to create social and physical environments that promote good health for everybody and promote quality of life, healthy development, and healthy behaviors across all lifespan. The video Healthy People 2020, Future Minutes of Health, I suggest that you review. And it's also on Blackboard. And what happens when you're ill for a long period of time? These are some of the effects that are illness or hospitalization on client's family. You get behavior and emotional changes. You'll see a lot of people get what I call grumpy. I use another word, but they're grumpy in the hospital because they're sick. The self-concept changes. They thought they were a very strong person. All of a sudden, you got the coronavirus and you're very sick for a couple weeks. Body image changes. Say someone who has an amputation, that's going to change the way they feel about themselves and how they feel, how they perceive that others feel about them. Hospital, obviously you lose your independence. Sometimes there's financial concerns. Some people don't have insurance. Your roles could change. If you were the breadwinner at home, all of a sudden you're hospitalized, and now your husband or wife, let's say, has to go and get a job so the money can keep coming in. Obviously increases stress, and it changes the social norm or structure of families. There are different kinds of healthcare settings. You have your inpatient settings, your hospitals, your long-term care, assisted living for retirement communities, your rehab centers, subacute centers, and your hospice, which is very important. Outpatient, we have your ambulatory care, your doctor's offices, occupational clinics, urgent care, child or adult daycare, there's crisis centers, and home care. Pretty simple stuff. We have our community health nurses. As you can see, it plays many roles. One of the big roles is advocate for the patient. What are the client's needs? You've got to go in and assess that. Does the client understand their rights? Do they have advanced medical directives, living wills, power of attorneys, things like that? Do they have a support system? Do they need additional referrals? Like, do they need social work? You're an advocate for this patient when you do community health nursing. Caregiver, what nursing skills does the client need? Do they need dressing changes, med administration, things like that? Care manager, coordinator, the nurse coordinates all the other healthcare services and maintains contact with the primary physicians or providers. They document the client's medical record of care services, and it is a legal and reimbursement requirement. And of course, they're educators. Nurse teaches the clients and families about the illness, treatment prevention, how to identify complication. This is ongoing, and this occurs at least with every visit. And you can see why home care less expensive, it's familiar surroundings, family can be involved. It has been shown to have improved client outcomes, and it can enhance the quality of your life, of their life. There are many services that are provided to help people out. There's adult daycare. Some of you may have gone and seen that on your ACE. They do counseling, physical therapy. They socialize people. You have special activities. You have your home care where people cook, clean, do meals, yard work. You have your hospice, which is so important to maintain pain management and give emotional and spiritual support to the patient as well as the family. Then you have your rehabilitation centers, which restores your body back to itself. Physical, you have physical rehab, occupational rehab, speech therapy, trying to get to the goal of improving whatever ailment that you may have. Long-term care, we're all familiar with, skilled nursing facilities. You assist with ADLs, medications. I think we all took care of dementia patients. They also do palliative end of care life right in the long-term care. And they have services like PT, OT, and ST. Assisted living, you get some personal care assistance, usually in a facility. And the level of service varies according to the license and regulatory concerns. Urgent care, we all know urgent care is minor illnesses, colds, stomach aches, and ear infections. This ends the lecture on health and wellness. Make sure you check out all the videos on Blackboard. Some of them are a little bit long, but they're very good. I hope you guys are feeling good today. I know it's been a trying time for most of us. And take care of yourselves and your families and everybody around you. And I will see some of you soon on Zoom. Have a good day, guys.